Hello and welcome to the March edition of the Residence Corner. I am Monica Krzalek.
And I'm Puneet Singh, General Surgery Residence at the University of Chicago.
We are honored to have Dr. Jessica Kandel join us today. Dr. Kandel is the Surgeon-in-Chief at the University of Chicago Medicine Commerce Children's Hospital, the Mary Campau Ryerson Professor of Surgery, Chief of the Section of Pediatric Surgery, and the Vice Chair for Pediatric Surgical Services at the University of Chicago.
Dr. Kandel received her medical degree from Columbia University. She completed her general surgery residency at the Massachusetts General Hospital. During her residency, Dr. Kandel completed a 2-year surgical research fellowship with Dr. Judah Folkman at the Boston Children's Hospital, where she investigated the mechanisms of tumor angiogenesis. She completed her advanced training in pediatric surgery at the Johns Hopkins Hospital. During her previous appointment as the Altman Professor of Surgery and Pediatrics in the Institute of Cancer Genetics at Columbia University, she served as the director of the Charles Edison Laboratory for Pediatric Surgical Research, where she co-organized the first Columbia University Art and House Symposium on Angiogenesis, and was a founding member of the Vascular Anomalies group at Columbia. She held the R. Peter Altman Chair in Pediatric Surgery at Columbia University and was acting chief of pediatric surgery before her appointment as the Surgeon-in-Chief at the University of Chicago Medicine Comer Children's Hospital.
Dr. Kandel was a leader in early studies that suppressed tumor growth by blocking vascular endothelial growth factor, and her preclinical research contributed to the development of bevacizumab, which is now gaining use in the treatment of multiple adult and pediatric tumors. Her primary clinical interests include the treatment of pediatric cancers as well as vascular anomalies. Her primary research goal is to understand how tumors become resistant to therapies in order to identify new treatments for refractory cancers. Her research has been funded by the National Cancer Institute, the American Cancer Society, and the Pediatric Cancer Foundation. She is the author of more than 60 peer-reviewed articles and 3 book chapters on angiogenesis and tumor growth. Dr. Kandel was also recently selected as a Fellow of the Executive Leadership in Academic Medicine, or ELAM program, which is dedicated to developing female leadership in academic medicine. We are honored to have the opportunity to speak to and learn from Dr. Kandel today.
Dr. Kandel, thank you so much for joining us today. We'd like to ask you a few questions to gain insight into your very successful career and to see what advice you have for surgical trainees. How did you become interested in the treatment of pediatric tumors and vascular anomalies during your training?
I had the opportunity to do a fellowship with Dr. Judah Folkman at Boston Children's Hospital, who was interested in tumor angiogenesis. And it occurred to me that his experience, which was mostly in mouse models, would be translatable to actual tumors of children. So that was a starting point for that theme. And then when I arrived at my first position, my boss said to me, "You know something about angiogenesis, so you're going to take care of all the children with vascular anomalies." And I protested to him that I knew nothing about this, but he said to me, "You're going to do it anyway." And so I did.
What has been your greatest inspiration in your career?
The patients and their families. It's a huge privilege to take care of children, and wonderful to interact with their parents and to share with them their successes and to support them through the tough parts of everybody's individual journey. And I just find the whole package really rewarding.
What is your most meaningful accomplishment in your career and why?
I don't think I've had it yet. So I really enjoy looking forward to what I'm going to do next. And I think I'm a little bit of an incurable optimist, and I think that the best is really yet to come.
What lessons have you learned from your research time in residency, as well as establishing your own research lab? And what advice do you have for aspiring academic surgeons?
The greatest opportunities I think we've had have been the experiments that haven't gone as planned, because those are the ones that are most likely to give you an insight that is unexpected. I'll give you a recent example. We're interested in exploring a new pathway for treating cancers that was being tested in various models of adult tumors. And we tried it in our mouse model of a neuroblastoma, blocking a pathway called Notch. And what was really surprising was that it slowed the growth of the primary tumor, but unleashed the growth of metastases to the liver. And figuring out how we had decoupled tumor angiogenesis at a metastatic site from the primary tumor was really, really interesting pathway for us to take.
Increasing attention is being paid to resiliency in surgery and preventing burnout. What is your advice to surgical trainees in regards to maintaining work-life balance and time management?
I think you have to be patient with yourself, to forgive yourself for being imperfect, and to remember that the greatest source of renewal and reward for us is our relationship with our patients. If you can go back to the bedside and recognize that you help more people every day than you may remember or you may register, that's a tremendous source of strength for all of us. At the same time, when you're imperfect, when you don't understand something, or you're impatient, or your fund of knowledge feels exhausted, you have to be willing to excuse yourself and remember that you're going to do better the next time and the next day.
What attributes do you look for in surgical residents applying for pediatric fellowship?
I want to know that I can learn something from them. So one of the questions that I ask people who are applying for fellowship is what problem they'd like to solve when they walk through the children's hospital. And the very best applicants and the most exciting fellows think of things that I haven't, and I find that very exciting.
Thank you so much, Dr. Kandel, for joining us today. It's been a pleasure.
Thank you.